my office, I see a lot of patients that develop fibromyalgia after a traumatic car accident. Because of the high numbers, I decided to look at the research and see what the statistics showed for this phenomena. What I found was amazing. Statistics showed the following. In a 5-year study conducted from 1990 to 1995, in one office, the records of 2,000 fibromyalgia patients were examined. Of these 2,000 people, 65% of the instances were due to a traumatic accident. Of this percentage, 52% of the sufferers of fibromyalgia were because of an automobile accident. Wow! Over 50% of fibromyalgia sufferers were caused by auto accidents. And this was just in one doctor's office. While the community searches for the link for this problem, chiropractic neurology has found the connection, and we know how to fix it. You see, I've been utilizing chiropractic neurology for the past year and have found great success in treating fibromyalgia patients. If you understand the mechanism of fibromyalgia, then you can find the cure. In chiropractic neurology, we examine the neurological makeup of the body and determine what area of the nervous system is not working because of stress, whether it be stress from a car accident or trauma, emotional stress, or chemical stress like drugs or tobacco. So let me explain the problem that occurs because of the trauma stress. In neurology, the basic makeup of the pathways is this: the cerebellum, the brain, and the lower brainstem and upper brainstem. Now, the cerebellum receives input from the entire body from everything that the body does. It controls balance, posture, and fine motor control. So when the body sends information to the brain, the cerebellum takes its needed information and then sends the rest of the information onto the brain itself. So the next part in the pathway is the opposite side of the brain. This is where we have emotion, thought, and function. After the brain gets its information, it then sends the remaining information to the next part in the system, the lower brainstem on the same side. This is where the pons and medulla are located, and this is your automatic stuff. It controls things like breathing, heart rate, and digestion. If all three of these parts are getting the correct information and working correctly, the lower brainstem then sends a signal to the upper brainstem, also known as the mesencephalon, and basically keeps it under control. You know, where a problem actually occurs is when that upper brainstem is allowed to go haywire because one of the other three pathway systems is having problems. The reason they have problems is when you have a traumatic accident, like a car accident, your body releases a substance called cortisol into your system to try and deal with the stress. Well, when too much cortisol is released, it's damaging to your brain and it will slow down the normal process. The upper brainstem then sends signals throughout the body and causes the release of some neurotransmitters called norepinephrine and catecholamine. These neurotransmitters then stimulate what are called nociceptive fibers or pain fibers in your body, and then you feel pain. Because this pain's there, your adrenal glands, which are some glands that sit on top of your kidneys, release more cortisol and the trouble begins again. So can you see the loop? An accident causes the release of cortisol, slowing down the cerebellum, brain, or lower brainstem, causing a cascade of other problems, which then causes the release of more cortisol, which then slows down one of the three areas of the neural pathway, and it starts all over again. Once you get into this loop, it's really difficult to get out without the proper help and therapy, like brain-based therapy. So can you see how a car accident could cause fibromyalgia? So to get the relief you need to find a doctor of chiropractic that understands these pathways and knows what to do to break the pain loop with brain-based therapy. One of my patients stated the following in an interview: "I hurt so bad that my blood felt pain. Dr. Harper started the brain-based therapy, and my pain was 75% better in a few weeks. There is hope, and you can get better now that you know what the cause is and why you have fibromyalgia after your accident. I hope this helps. So until next time, good health and good living.